As of the 1st of July 2020, things are changing in dentistry, and as promised, I'm here to keep you in the know. This is an update to my previous video, Covid-19, visiting your dentist. So if you missed that, I'm going to pop a link to that video in the description below. So what's changing? Well, as of the 1st of July 2020, dental practices are going to be able to offer a full range of dental treatment again for the first time since the beginning of lockdown, including AGPs. AGPs are aerosol generating procedures, which basically just means any procedures that create an aerosol. So any use of the drills, the ultrasonic scaler, which is the scaler with all the water, the 3-in-1 tip, which is, when we go and spray air, blow air on your teeth or blow water on your teeth, things like that all create an aerosol. So up until now, we've not been able to do treatments that involved any of that because of the risk of spreading COVID. But now it's been deemed that it is now safe because of new procedures that we have put in place to keep you safe. So dentists are able to offer a full range of treatments again. What this means for you, well, if you've been waiting to see a dentist or a happy hygienist, you may now be able to do so. However, please be aware you might have to wait a little while because we are still prioritising patients. So currently we're still triaging all patients. So you'll be talking to a dentist on the phone before you're invited to come in, and you'll only be invited to come in if the dentist feels it's necessary. Also, we're prioritising patients who are in a lot of pain, emergencies, urgent treatments, also people who have open courses of treatment, so people who began treatment prior to lockdown and maybe you had appointments booked in at the end of March or beginning of April to complete that treatment, and obviously your dentist couldn't do that. So you've been left with maybe a temporary filling, for example. So those people are going to be in priority to get them in and finish those treatments that have been started. Also people at high risk of deterioration. So if people who are suffering with bad gum disease, for example, and need to be seen really regularly to keep on top of that, those are the sorts of people that your dentists will be prioritising and getting in first. Once those people have been seen, then your dentist will be able to start seeing more routine patients again. What's going to be different? Well, your appointment will need to be longer because of the new policies and procedures that we've put in place to keep us all safe. You're going to need to set aside a bit longer to actually be with us in the chair, which does in turn mean that when you come to booking your appointment, there will be less availability, less flexibility with regards to your appointment times. Also, if you are vulnerable, if you are shielding, if you are a high risk patient, please do let us know when you book your appointment. This because you will probably be given the first appointment of the day, and that is because this is the time of day when the air is cleanest and the risk is lowest. You may also notice that the surgeries are looking a bit bare, they're not as homely as they used to be. This is because we have taken everything off of the walls, everything off of the surfaces. It's all been put away because reduced surfaces means reduced risk when it comes to cross-infection. And it also means there's less to clean, which is nice for us. So it will look a little bit like we just moved in. You can also expect there to be more suction going on during your appointments, even for treatments that previously you wouldn't have had any suction at all, such as, for example, a hand scale, which is something that I will be doing. You may find that your hygienist will be using suction where she didn't previously, but this is just to reduce the risk of any splatter, any aerosol that may be created, things like that. So don't be alarmed if we come at you with more tubes than usual. And also do let us know if it's uncomfortable, if you have a gag reflex, please let us know. And we will do everything we can to keep you as comfortable as possible. And finally, we will be even more heavily clad in PPE than before. And we thought that was a lot. But when we're doing the AGP, so the aerosol generating procedures, we're going to be needing, full length gowns and respirator masks and, a wraparound visor. You're not going to be able to recognise us really. But we are in there, promise. And we are the same gentle souls who took care of you before. So please don't be afraid of us just because we're wearing all this scary new gear. Many dental practices are now adding a PPE surcharge to the cost of their private treatments. How much they're adding, unfortunately, is dependent on per practice. I wish I could give you a figure, but also who it's affecting is depending on per practice. So NHS treatment is not charged an extra PPE surcharge. However, if you're on a dental plan, you'll need to check with your practice. If you've already started your treatment before the lockdown and you're continuing your treatment, you'll need to discuss with your practice again whether or not you're going to be charged for that PPE. So be sure to get in touch with your practice just to find out what their new costs are and also whether or not you're going to be affected. So as always, I will keep you informed of any changes as they happen. So subscribe me and click the little bell so you don't miss anything. And until I see you next time, stay safe and keep smiling.